he opened Inside 2019, also at this place. And I remember the first thing he did was telling jokes. Is that on the plan today? No? Yeah. So that was great fun 4 years ago. But we also invited Matt to talk a little bit about potential ways that implementing and bringing psychedelics legally into the world could go astray. The different things that could happen, so that we're reminded of what to avoid. Thank you, Matt, and welcome.
Thank you so much, Henrik. And yeah, this is great returning once again. My second time at this meeting was unfortunately over a Zoom screen during the kind of the height of the pandemic or close to it. So it really feels good to be here in person. And so let's see. No jokes planned, but I think I came up with one a while back. I don't think I've told it at Insight before. If you've heard me, I've told this maybe once or twice, so there might be some overlap in the audience, but here it goes. Why did the American tourist take sclerotia rather than fruiting body mushrooms when she was visiting Amsterdam? Why did she take the sclerotia of the fungus rather than the mushroom? This is for the real mycophiles. Because she didn't want to get in truffle. That's kind of what I go for, the bad dad joke. Sort of, for those who don't know, it's like the sclerotia or the truffles are like the roots, so to speak, of the fungus. And by technicality, you can get those, but not the fruiting body mushrooms. Same thing. You take enough sclerotia, you're going to get the same, some level of psilocybin that you want. So, not encouraging it. Just so thanks for bearing with me. With that said, I can do nothing to embarrass myself at this point. So now I feel really relaxed. Before going forward, just like to always tell folks, I do have some current advisory relationships with some various companies developing psychedelics or related compounds through the FDA pathway or involved with the industry. And although I'm not speaking about any efforts of those entities today. So one of the several reasons that I became interested in psychedelics 30 years ago, before my educational formal involvement with psychedelics, is people tend to come out of psychedelic experiences dealing with what I call the big questions. And these fall into different categories. What's the nature of reality at the physics level, at the metaphysical level, at the spiritual level? What's meaning? Does anything mean anything? What's the point of it all? Does God exist or anything like that? As far as I know, psychedelic science hasn't come up with any answers or anything close to those problems or solving the hard problem of consciousness. But I think we can say that compared to the average day, the average 6-hour chunk out of your day, someone on a high dose of psilocybin, let's say, or another classic psychedelic compound, is a little more likely or a lot more likely to grapple with those types of questions. And I do get some sense that there is some value in grappling with those questions. Unlike many of our ancestors, most of us don't spend the time every day, every evening looking up at the stars and wondering. We're stuck in front of screens, et cetera, in artificial environments. So perhaps that's a part of the value that people come away from psychedelics. Simply, even if there are no answers for that person, just having contemplated those questions. But I think that prompts a growing concern that I've had over the last, really, it's hard to count, but several years, probably to some degree dating back a decade in psychedelic research. And that is that when it comes to grappling with these big questions, I think it's going to be extremely important that we carve out a model. And here I'm talking about in mental health treatment by physicians, clinical psychologists, social workers, nurses, etc. I'm not telling any religion, not providing any advice whatsoever on what to do, or even individuals in their personal use. This is advice for mental health professionals. We've got to let the patient, the client, the research participant, if we're talking about trials, we've got to let them drive the bus on any of these metaphysical questions. And I think that's a tough thing, and something that I know that advice, I put it in a commentary paper several years ago, and I've gotten, I'd say, a large majority of feedback is more in the kind of, well, thank you, thanks. I'm glad to hear someone say this, because, it's been a concern, and I've gotten some pushback as well. And I guess in my view, some of the pushback has been a misunderstanding. You mean to impose materialism on the patients. That's not right. And I've tried to be very clear. Any sort of philosophy, let the patient drive the bus. You don't say, oh, no. You didn't see Jesus in that session. That was serotonin 2A doing its duty. Or that wasn't plant spirits, or that wasn't, you name it. If it's outside of sort of the norm of clinical mental health, hopefully empirically grounded, but at least the norm of clinical professional frameworks, we need to be really cautious about what we were introducing to patients. So one concrete example of this is just the use of religious icons in these sessions, which I'm not sure, I haven't collected any data, I know are pretty commonplace in many of the sites doing clinical trials on these compounds, such as psilocybin. One of the most common is the Buddha, but sites will have the Buddha and Hindu gods and sometimes a crucifix kind of stuck back in the corner, maybe a little less prominently than the Buddha. But I take the advice of sort of, I think back to college. It's like, BYOB, bring your own Buddha. So this is very much in the spirit of, yes, you're not there to tell someone what not to believe. Someone brings up Jesus. I've discussed a lot with my colleague Peter Hendricks in Alabama, doing work treating cocaine addiction with psilocybin. No surprise, Deep South, largely Black American participants, Southern Baptist, for example, is your typical, participant. Jesus comes up a lot. It's not your role to confirm nor deny. I would say it's your role to support. It's your role to use reflective listening, to draw out meaning, whatever meaning that person is making, and provide a caring, reflective, professional support for that person, regardless of whether it's plant spirits, whether it's just contemplations of the Big Bang, whether it's any nominal religion, or whether it's none of the above. And I can say from having done that in many sessions myself as a guide that thankfully I've never had a participant that has asked me, that was really dependent on Matt, you've got to tell me, what's the answer to this? Was this really a glimpse of another dimension? Was this some contact with the deity? Was this was this the astral plane? Because frankly, I have no idea. I have my own personal guesses, perhaps, and those might change on a day-to-day basis, or maybe on a moment-to-moment basis on some days. But as I tell participants when I accept them into a study, if they have any such experiences at that metaphysical level, they are driving the bus. They are the world's expert on what the ultimate meaning of their own experience is. And so I want to be very cautious, and I'm not advocating a cold. I've been very worked on this for years. Like, it's critical that we have agape, that we have this brotherly, sisterly love, this caring for the patient, for this model to work. I think across psychotherapy, and this is psychotherapy, like Max told us last night, that's part of the key ingredients of making psychotherapy work. And like much of psychotherapy, you know, psychedelics put it under an even greater magnifying glass. So that's very important. But to really let that patient or that participant client drive the bus. So I'd suggest, you know, and people, I think a great model is to invite people to bring any meaningful objects to these sessions. Could be the Buddha, could be a Jesus, could be a dream catcher. It could be a flying spaghetti monster model, for those familiar. We got any Dawkins-style atheists here? That's welcome. I've had a number of atheists in these studies, and they were atheists coming out, and they typically really valued and benefited from these sessions. And so one of the concerns I've had is that we don't know who's not showing up. We don't know that the Muslim individual is seeing this in the press and saying, that's not for me. That's not for me. We don't know about the Southern Baptists, a tradition I grew up in, who agree or disagree, might conclude that's a false god, that's of the devil. I heard that a lot when I was in Sunday school when I was a kid. That's not for me. Even if you're dying of cancer and you could greatly benefit from that, that's keeping me away. Or the Richard Dawkins-style atheist. That's not for me. And so again, I'm not denying, bring your own meaningful objects, include pictures of the family, religious symbols, etc. It's all welcome, just like any experience they have. And this plays out at another level as well. It's not just the explicit religious symbols, but I have a concern really at, I guess, what I could call the meta-religious symbol. For those familiar with psychedelics, many will be familiar with this idea known as perennialism or the perennial philosophy. Aldous Huxley had a wonderful anthology written many decades ago about this philosophy. The idea being, as exemplified by the classic tale of the elephant and the blind man, that all the world's religions kind of point to the same core truth. And personally, I think that's an intriguing idea. You know, personally, perhaps some truth to that. I think, you know, that's out there, but it's, you know, kind of like the hard problem of consciousness, or, you know, the belief in God, or you name it, that falls beyond the realm of empirical science. So while it might be it is very appropriate for a patient, a client to contemplate concepts such as this, I would also advise, even at this level, to be subtly or explicitly sort of pushing the perennial philosophy by having the world's religions icons present, and through discussion. I think even at this level, we have to step back. I mean, frankly, even at the scientific level, if someone spontaneously brings up, oh, wow, I had this vision that the world's traditions are pointing towards the same core truth. Frankly, as a scientist, I'm far more interested in that, on that data point. If they're saying this, and I hadn't fed them the idea through having all of the the religious symbols present, it's a little more compelling. It doesn't prove the ground truth, but it's more compelling that it came up. And so this is related to what I call the guru complex. I think it's important. You see, it's having been in with psilocybin and some other psychedelic compounds, hundreds of these sessions as a guide, monitor, whatever you want to call it, a therapeutic type role, even if it's not explicitly therapy, and depending on the nature of the study. I can tell you, you know, it's really heavy to be the person or one of the two people that, you know, you introduce this person, you sign their consent form, and you're in this room with them, someone's holding their hand if they're having trouble, and sometimes they say this was the most meaningful experience they've ever had as a human being. And sometimes this is a 70-year-old person who's had a quite accomplished life. And that's like humbling. And like how was I in any way involved with that? Like, that's really heavy. And I think this is one of those areas where the grounded professional ethics that in different flavors we get as physicians, as clinical psychologists, as experimental psychologists such as myself, social workers, nurses, all of the relevant helping professions that provide professional boundaries that they I think would steer you towards how to appropriately have boundaries which allow you to help this individual without letting it go to your head, that power dynamic, which we know is there, even if you're just going to your general practitioner for a yearly checkup. There's the white coat, and there's the magical script, and they can give you any drug they want, or at least EMA, FDA approved drug that they want. A lot of power, a lot of social hierarchy there, a lot of ritual, as was mentioned in the panel last night. So that comes with a lot of responsibility and weight. So here my concern is that, you're providing advice. You're sending people to your own particular flavor of retreat center. You're making advice on books like Eckhart Tolle's Power of Now, any number of sort of spiritual advice to people. One concrete example is that I had a participant in my smoking research had a particular type of experience and was discussing it with a colleague who said, have you heard of Kundalini? That kind of sounds like a Kundalini experience. No, I've never heard of Kundalini. What's that? Tell me more. This led to her reading, by her account, many books on Kundalini. She became very concerned. She had read that you can die from a Kundalini experience. Did you guys know that? Do you know, that wasn't in the consent form. And I'm being serious, really concerned. This was not the regular mystical experience that I've read about. This is Kundalini. And this is one of the examples that has sort of helped nudge me towards this framework of we've got to be really cautious about playing guru, about going beyond our roles, what our professional training is, and providing that sort of metaphysical, I get spiritual advice, but the caveat is when I say spiritual, that can mean stuff any secular professional would agree upon, connection to others, finding meaning in life, whatever that is, feeling part of a community, a human community even. Richard Dawkins would, I'm sure, endorse all of those things as being important, or it can mean the explicitly supernatural and religious. So it's that latter part that I suggest is we leave that to others. And again, not telling the UDV or any psychedelic using religion what to do or providing any advice. Psychedelics are highly suggestible research. They make someone highly suggestible and they're highly meaningful experience often. So that can lead to the psychedelic exceptionalism. The idea, this was mentioned in Max's talk last night, and I think quoting a paper of mine that, these experiences are so big that the normal rules don't apply. And Tim Leary, I think Dr. Leary, show some respect, he was a brilliant man, did great work. I was a fan of fascinating books but he did do some things I think we can learn. He was a teacher in terms of providing positive and negative examples, what we may not want to repeat from him. And one of these is saying, this is too big to fit into the academic game. This is too big to fit into the science game. It's too big to fit into the medicine game. And I think that's the wrong approach. That's psychedelic exceptionalism. And I think one aspect where you'll find that is that, this work is going to save the human species, literally. This work is going to save the human species. And I frankly think that is failing to learn the lessons of the 60s. I think it's a lack of humility. I'm really concerned about our species surviving. And if we do, I think it's going to take a whole lot of us doing a lot of different things, working on the environment, feeding people, getting through, pandemics, and who knows what's going to await for us. AI taking over. I mean, the great next comet hitting us. It's going to take all of us doing a lot of different things, but I think we need a little humility in hoping this can help a lot of people if we bring it into mental health. But we're going a little too far when we say it's going to save the human species. Because when you have that mentality, whether it's religion, whether it's a political idealism, that type of thinking tends to, if that's the view, anything is justified. Anything. Ethics are kind of out the window if that's the ultimate, if it really comes down to the human species. It justifies anything. We need to watch out for that. So my advice is to cling to boring old ethics that you learned in your various professions, if you're a mental health professional, as a physician, a clinical psychologist, etc. I do have some concerns. I've got a minute, less than a minute now, concerns about how we deal with phenomenology, how we interpret survey data. You know, it's important to study people's experiences, but as many people have an experience of, you know, there's DMT experience leads them to believe in an afterlife, doesn't mean we've provided any empirical evidence about the existence of an afterlife as one of a number of examples. So we need honesty in research. I think I'm at about 30 seconds left here. We need honesty in research. This is another kind of area of advice. We need to stay away from, and I'm guilty of this and trying to do better, but stay away from advice to, oh, don't collect data on the creditability of the blind. In other words, asking the person afterwards, do you think you got placebo or do you think you got the real thing? And you know, that it's important to do that type of assessment because you can use that analytically to determine how much of the placebo effect may have influenced things. But if you that's kind of the wrong question because like the data aren't going to look great. And that might make psychedelics look bad and give the adversary some ammunition. We're about to unleash this on the world, folks. We need the truth, and we need to tenaciously cling to the truth and not be afraid to get at some of these criticisms. Also, fear of asking people about subsequent psychedelic use. Guess what? Sometimes it's not highly addictive, frequent, but sometimes our patients are introduced for the first time and they use psychedelics again. We didn't need to know that landscape. And leading participant responses, be cautious how you do this research. Oh, you know, you gave a 3 on this scale and gosh, your discussion with me personally sounded like you had a more impressive experience than that. Do you really want to consider revising your answer? Really concerned about how we're driving data like that sometimes in this area of research. And adverse reactions. In our group, we had someone, I saw the video, I wasn't in the session, but tried to dive through this painting on the wall. Bumped their head. I discussed it frankly in a podcast. It looked to me, frankly, like the very rare cases where it has seemed like 1 out of millions, but sometimes someone thinks they can fly. And like the comedian Bill Hicks said, if you think that, you should probably test that idea on the ground rather than out of a window. But it looked to me like this was, like she fully thought she would be sucked into another dimension. And so I want to frankly tell people about this before we unleash it to millions. And so getting pushback from, if you get pushback from colleagues, as I did for speaking frankly about this, I think we need to just cling to the truth and letting people know the real deal, that sometimes this happens. And so I think taking this advice will minimize a cult-like atmosphere, make psychedelic medicine available to people of many faiths or lack thereof, minimize abuse of patients, increase understanding of negative effects. And that's it. Thank you. Thank you very much.
Thank you, Matt, for helping us to keep both feet on the ground. I think there are 2 or 3 questions that we can answer before the next talk, or you can ask. So,
or a joke.
Or a joke. Yeah, of course. Can I? Because
I invite disagreement. You know, I've introduced some. You know, like.
Processes going on. Do you worry about the way that MAPS philosophy and their training is sort of seeding the world because of the regulatory process in the FDA?
Yeah, so I may not be familiar with all the details. I guess I haven't seen anything really salient. I'm happy to address a more specific, but, you know, I don't know, like something came up, it seems relatively minor in the scheme of things, but came up last night in the plenary panel of, I think they used like the internal family systems idea, which could be seen as, that's one of those models where I think it's fine to use if, depending on the nuances, recognizing, hey, this is metaphor. There aren't different little people inside of you. There aren't, different, it's sort of like, I have some concerns about, I'm very open to psychodynamic thought, and actually the psychedelic work is really opening up, but you gotta be cautious when you start talking about your ego. I've had a participant get really upset that she didn't follow the advice given to her was like, your egos are gonna try to trick you, and she thought she had lost her ego, and I didn't think it was a useful model, because it was this sort of like internal, and it's like, yeah, ego, it's a way to describe a process, a way of thinking, and so I could see similar things happen with the internal family systems framework, depending on how you treat it as a concrete thing, like an inner homunculus or multiple homunculi, if that's the plural, versus metaphor. I mean, that's one thing that comes to mind with the map. So no hard critique on that, but just nuance.
Hi, Matt. Thanks for this beautiful talk. Maybe kind of following on from this discussion, I was wondering how you see it when, so not in terms of the content of an experience, but when people have a very fixated interpretation of an experience. So someone says, I definitely saw an angel. This is definitely what happened. My temptation would be to say, this is surely true, but maybe there are several ways of looking at this that are all true at the same time. So to kind of loosen it up a bit, do you just leave it as it is, or do you kind of, interfere a little bit?
That's a great question. And I could imagine nuance there. I mean, I think the first thing to tell the person is I don't know. I'm not the metaphysical, guru here. I would say it comes down to, are they checking off basically DSM criteria? Are they saying the angel is hearing them, talking to them through the radio when they leave the session and type of thing? As a real example of maybe this is schizotypal thinking that you've inspired, that the session has inspired. I frankly don't think I would say, it might depend on the nuance, but I don't think I would say, well, there might be other ways that maybe it wasn't actually an angel, because really, I don't know. Maybe it was an angel. Truly, I really don't know. And, it would only be if they said something that, again, started checking off diagnostic criteria, like with that clinical wisdom, just your standard therapist. You don't think the person is crazy if they're a Christian and they think Jesus has spoke to their heart. But if you think Jesus has spoken to you through the neighbor's dog and encouraging you to commit violence, that's in a different category. So extreme example, but yes, along those lines.
Okay, you mentioned in the beginning how important it is in your mind to let the patient be the author of their experience and how they make sense of it. But still, then I would argue that just the setting of only allowing it in this clinical setting with the therapist and so on is already imposing a rather narrow frame of interpretation. I couldn't use it with my friends, for example, or at a festival or whatever. So do you think maybe long term we should also broadening the horizon and thinking about other settings?
Yeah, I think that's, and as I tried to express earlier, whether it's a religious setting or just people using it on their own at wherever, Boom Festival, Burning Man, or your own, living room. This is not advice to individuals. It's not advice to participants or individuals using out there. So, but yeah, there's a truth. There is no lack of set and setting. There is always context. And so, yep, this is a clinical context, but if it's being used in mental health, whatever that looks like, whether it's a beautiful retreat center or whether it's a room in the back of a complex hospital building, that's a context. And so yes, that's introducing. I don't think that's a context that introduces supernatural beliefs of one type or another. It introduces certain things like, I don't know, perhaps a faith in Western medicine, but it's, like it or not, it is part of Western medicine if you're giving a prescription for an FDA-approved product. But again, I don't think that borders on the supernatural in any way. So great question.
Thank you, Matt, for your contribution. Thank you.